These are the non-fermenters. Here are your objectives for this lecture. Some general characteristics about these organisms we'll talk about is they are aerobic, motile, and gram-negative bacilli. They do not ferment carbohydrates. They grow on MacConkey agar, producing colorless colonies, so that means they are non-lactose fermenters. They are commonly found in soil, water, and vegetation. For important genre, we have the Pseudomonas aeruginosa. So this is a major pathogen, and it's known for opportunistic infections. And some others include Acinetobacter, Flavobacterium, Alcalogenes, Moraxella, and Xanthomonas. Pseudomonas is slightly thinner and paler on gram stains than the Enterobacteriaceae. They can be short, straight, or slightly curved rods. Pseudomonas is motile, and it does that by a single polar flagellum. The Pseudomonas can produce a pigment, primarily a piosan or blue type color, and sometimes even a wound that's infected with Pseudomonas aeruginosa. The drainage can have like that pigment to it as well, and will generally have a wider growth range than some other organisms. Pseudomonas will grow anywhere from 20 to 42 degrees, and Pseudomonas species are found worldwide in the environment. Pseudomonas is known for being an extremely hardy bacteria. It has the ability to break down toxic substances in the environment. The cell wall is relatively impermeable, contributing to its resistance. It's highly resistant to many antimicrobial agents, and Pseudomonas aeruginosa can be found as normal flora in the throat and stool of some individuals. For Pseudomonas' clinical significance, so this is an opportunistic pathogen primarily affecting immunocompromised patients. It's the second most common gram-negative bacillus isolated in nosocomial infections after E. coli. It can cause infections in healthy individuals, mainly through deep puncture wounds or trauma such as a car accident wound. For environmental reservoirs, so this is commonly found in hospitals and extended care facilities, and it's present in soaps, water, humidifiers, respiratory equipment, and other moist environments. Pseudomonas also can be seen with infected burns and wounds. Again, these wounds may excrete that blue-green pigment, so that piosanin. Pseudomonas aeruginosa is the only organism that produces that pigment, so it is a defining feature. So make sure that you remember that. This can cause swimmer's ear, folliculitis, eye infections, meningitis, brain abscess, nosocomial urinary tract infections, endocarditis, and pulmonary pneumonia. For laboratory identification for Pseudomonas, you would see a pigment production, notably that piocyan, which is that blue-green pigment. It is oxidase positive, catalase positive. It is motile by that single polar flagellum. And as far as the colony characteristics, so on blood agar plates, colonies may appear flat or feathery with a distinct ground glass texture. It will often show strong beta hemolysis as well. For clinical significance, the presence of Pseudomonas aeruginosa in blood culture can indicate a serious systemic infection. Cultures may produce a distinctive grape-like odor. In the triple sugar and iron test, or the TSI, this produces alkaline or red slant over an unchanged or red butt, so it has an alkaline acid reaction. It indicates no fermentation of glucose, but possible oxidation. For growth characteristics, it can grow at 42 degrees Celsius. In oxidative fermentative tests, so this can differentiate Pseudomonas aeruginosa from Enterobacteriaceae. It produces yellow color only in the open aerobic tube, which shows a glucose oxidation. There is no acid production in the anaerobic tube, which means there's no fermentation. If you're in my course, there is a video there to go ahead and watch, so make sure you download the PowerPoints. So a little more on the TSI testing. So this is used to differentiate enteric gram-negative bacilli based on their ability to either ferment sugars, which is glucose, lactose, or sucrose, produce hydrogen sulfide, and or produce gas. The components of what it's made of is glucose, lactose, sucrose, phenyl red, and ferrous sulfate. So Pseudomonas aeruginosa on the TSI will produce an alkaline slant, which is red, and alkaline butt, which is red. No acid production because it does not ferment sugars. It may show an alkaline slant over an unchanged butt, or simply, if you look at the little chart down below, it'll show like a K/K reaction, depending on the strain and conditions. There's no gas or hydrogen sulfide production, and this helps distinguish Pseudomonas aeruginosa from enteric fermenters like E. coli, which produce acid in both the slant and the butt. So that would show an A/A reaction. Antibiotic resistance. Pseudomonas aeruginosa is one of the most highly resistant gram-negative organisms. Its resistance is due to its impermeable cell wall, efflux pumps, enzymatic degradation of antibiotics, and biofilm formation. So we'll have to consider treatments. So sometimes they'll use a combination therapy, which is recommended to prevent resistance development and increase efficacy. A common example would be penicillin plus an aminoglycoside. Antimicrobial susceptibility testing should always be performed on clinical isolates to help guide the therapy. Burkholderia cepacia, so reservoirs and transmission. This is an important nosocomial pathogen. It is found in contaminated medical devices and disinfectants. Infections often related to improper sterile technique and colonizes the respiratory tract of cystic fibrosis patients. For associated infections, it is known for lung abscesses and pneumonia, especially in those immunocompromised and cystic fibrosis patients. Acinetobacter is a gram-negative non-glucose fermenter. It is a short, plump, gram-negative to a point where they could be considered a coccobacillus, and pairs of maybe intracellular Actinobacter can be confused with Neisseria. Acinetobacter is found in soil, water, and sewage, and this can be recovered from skin, mucous membranes, and secretions. This is often isolated as a contaminant or a colonizer and can cause nosocomial pneumonia in patients undergoing respiratory procedures. These infections are linked to use of contaminated medical equipment or solutions. Culture characteristics of Acinetobacter is that they usually grow a gray-white colony on blood. They have a colorless conche. Remember that while it can be confused with Neisseria, only Neisseria meningitidis will grow on a blood plate. It is oxidase negative, so again, that's another way to differentiate from Neisseria. And it is a carbohydrate non-fermenter and does not reduce nitrate to nitrite. Flavobacterium, so it is an aerobic gram-negative rod with rounded ends, and it is found in the soil and water. It is not part of the normal human flora. So clinical significance, Flavobacterium meningisepticum is the most common species causing human infections. Flavobacterium is usually a nosocomial infection and can be found in contaminated saline solutions, water baths, incubators, and catheters. It commonly causes infections in infants, especially the premature babies. For clinical significance, this can cause neonatal meningitis, and it's an important pathogen in the neonatal intensive care units. For lab identification of Flavobacterium, so growth conditions, it grows best at 25 to 30 degrees Celsius. The primary isolation is going to be on blood agar plates or chocolate agar. For colony characteristics, it's small, round colonies on the blood agar plate and lavender green discoloration in the red blood cells. For biochemical characteristics, it will have an oxidase positive, catalase positive. For clinical specimens, it can be recovered from blood cultures in meningitis cases. And for antimicrobial susceptibility testing, we are going to perform that on all isolates. Alkalogenes can be part of normal flora at different body sites. It's primarily an opportunistic pathogen. Some common species are Alkalogenes faecalis and Alkalogenes xyloxidans, which is the most common species. For clinical significance, it most strongly is associated with urinary tract infections or UTIs and wound infections. It is often isolated with other organisms, so it sometimes will be known as a mixed infection. For colony morphology, they will be flat, spreading, rough-looking colonies on blood agar plates, and they may have a feathery appearance, and they may also show alpha homolysis. For biochemical reactions, they'll be oxidase and catalase positive. They will be motile, and alkalogenes xylocanidans can reduce nitrate to nitrite. Also, we are going to perform antimicrobial susceptibility testing on all of these isolates. Stenotrophomonas maltophilia, so some general characteristics. It is a gram-negative rod. It is found widely in the environment, and it will commonly colonize the oropharynx. Nosocomial infections are increasing with Stenotrophomonas maltophilia. This is commonly seen in patients receiving antibiotics, and it is frequently isolated from respiratory tract, wounds, blood, urine, and skin cultures. Bacteremia associated with long-term use of plastic IV catheters. This is the second most frequent isolate among non-fermenters. And for biochemical characteristics, is it oxidizes maltose in glucose. It is motile and oxidase negative. It also does not produce any pigment. For colony morphology, it is rough, grayish, or lavender green colonies on blood agar plates, and it has a characteristic ammonia-like odor. For treatment, we're going to do antimicrobial susceptibility testing, and this will help let us know what to use. And generally, trimethoprim sulfamethoxazole is usually effective.